I want you to think back to when you were 16 or 17 years old, deciding what you do with your life. I wonder what careers you contemplated. I thought about occupational therapy, nursing, physio, a few other things, but I gravitated to a media career in the end. I wonder what my next guest, Dr Richard Schloeffel, who has a very distinguished career spanning more than 46 years, contemplated. He is a wealth of knowledge, and I wanted to have a chat with him before he retires. Dr Richard Schloeffel, thank you for joining me on the Drive program.
Oh, it's a pleasure. Thanks, Kylie.
And so you have done so many things across the course of your career, but before we dive into many of those different aspects, when you were, a young lad of 16 or 17, were you always very focused on going into medicine?
No, not at all. When I started thinking about what I want to do, I want to go and be a sculptor.
Really?
A sculptor, and I've somehow got high enough marks to get into medicine, and I chose that was a better career. I was probably going to make a better living of it, and I went into medicine. So it was really just opportune. It was around that time, just before Gough Whitlam made university free, and there was an opportunity there, so I took it. 1972 I started medicine, so it's a long time ago.
Yeah, okay. So now one of the things you've really focused on through your career is chronic fatigue syndrome.
Yes.
So, over the course of your career, sort of where have we landed with, the latest developments, what we know about it, about recovering from it? What can you tell us?
Well, it's actually known as Myalgic Encephalomyelitis, chronic fatigue syndrome, so ME/CFS. So the ME part is the inflammation of the brain and the muscle, and the chronic fatigue are the symptoms you experience. So that's why we combine the term. And I saw my first patient with ME/CFS in 1981, so that's a long time ago. And it was just one patient. I didn't really think much about it. I just worked with this patient for 5 years, and gradually they improved. And then we had our first pandemic, which was HIV. And I became an HIV GP, and I worked with hundreds of patients for about 14, 15 years. And I saw similarities in the patients I was seeing with post-infection fatigue syndromes, which is ME/CFS, and HIV patients, especially when they develop fatigue and other things. Unfortunately, those patients didn't survive, a lot of them. But gradually, as that pandemic was brought under control, I had a particular interest in ME/CFS. And in 1997, I chose just to see patients with this condition. And I've seen over 6,000 patients since that time. I'm currently involved in research. I teach doctors about it. And I'm hopefully an advocate for those 250,000 patients in Australia who have ME/CFS before we developed this condition called long COVID. And we might have another 200 or 300,000 people with this condition, and they don't have much of a voice. So I'm part of that process of coming out and being, hopefully, a voice for them on a medical point of view anyway.
Yeah, and that's the important thing, is having a voice, isn't it? Because,
yes.
If you don't have a voice, you're sort of lost out in space.
Yes, well, I mean, ME/CFS is not a sexy disorder, as I say when I'm training doctors, and it's hard work looking after people who are chronically ill, housebound, bedridden. 60,000 people are housebound, bedridden with it. 90% don't have a doctor. It's a very sex-orientated disease. 75% of patients are women, because they're more prone to get autoimmune inflammatory disorders post-infection or whatever's caused their ME/CFS. So, and there isn't much interest in research. There isn't much interest in undergraduate education or doctor education. And there's definitely a problem with diagnosing and managing these patients, because they're often gaslighted. They're often told that they've got a psychiatric or psychological illness. Their symptoms aren't real, and their condition is imagined as opposed to a pathological disease process, which is what it is.
Now, not being effectively diagnosed must be a very challenging part for patients, because there must be a lot of people who don't get the correct diagnosis.
Most patients don't get the correct diagnosis. One, GPs aren't trained to recognise it, and if they do, they think, oh, this is one of those heart sink patients, I don't know what to do. So the diagnosis is made by clinical assessment, There isn't currently a blood test or a series of tests that you can do to formally diagnose it, but there is a pathway to diagnose it, and there's a pathway for management and a pathway for treatment for these people, but it's not taught to undergraduates, GP registrars, GPs, or even specialists. So there's all these people, which could be up to 500,000 Australians with this condition, and it's a lonely field if you're a doctor in this field, because there's very few of us. And after 46 years, I've decided to retire, and probably retired for a couple of reasons, mainly for research. That one of the things I'd like to do is help develop a biomarker, some way of helping people be diagnosed so they get a proper diagnosis, and that may lead to proper management.
For some reason, I can hear a very squeaky chair in the studio.
Oh, sorry. Yes, that's all right. It's the squeaky chair.
Yep, you get
I'll
that.
keep staring. I'll stay very still.
Yeah, you'll have to speak and stay still. And so now the other thing I wanted to talk about is, autoimmune conditions, because they are many and varied, aren't they?
Yes.
And also, once again, quite hard to diagnose. We would have a lot of listeners with autoimmune conditions, leaning in, listening to this conversation.
Absolutely. Now, autoimmune diseases we define as doctors as all ranges of diseases, from Sjogren's syndrome, rheumatoid arthritis, lupus. There's a whole lot of names for these conditions, but primarily they're various inflammatory disorders that affect tissues and organs, leading to disability and a whole range of symptoms. And in ME/CFS patients and people with post-COVID, there is an acceleration of these conditions, and sometimes infection may trigger these conditions, and there's a relationship, because many people with ME/CFS, actually 30% of them end up with autoimmune disease, which has given us an idea, and we've seen this with COVID as well, that it's given us an idea that these conditions are often triggered by infections. It doesn't mean the infection's persisting, it's just that there's a trigger, especially in women, to develop these disorders. And that's how I've developed a large practice of patients with autoimmune disease as well, because they were originally maybe post-infection fatigue syndrome, ME/CFS, and they progressed into autoimmune disease. And now I can see there's a very strong relationship. And with post-COVID syndromes, of which I was predicting back in 2021, I spoke on ABC radio saying we're going to have a very large number of people, and we do have a large number of people with this condition, and lots of people don't have a voice. They actually may present as autoimmune disease, but their blood tests will be negative. So the diagnostic pathways to diagnose them often aren't there with this particular group of patient, even though they've got all the symptoms of autoimmune disease.
If anyone has just tuned in, you're hearing the voice of Dr Richard Schloeffel, who is retiring after 46 years, but he has a distinguished career, and a wealth of knowledge in everything from chronic and complex diseases that include chronic fatigue syndrome, autoimmune conditions, and also tick-borne diseases, which we'll get to in a moment.
Yes.
And I want to just interrupt for a moment to let everybody know that we're getting a lot of questions. Lalani has texted in saying, any idea what's going on down at Kingston Margate? There's helicopters flying around, police cars all over the place. If anyone can update us on that. But producer Stephen will get on to police media to attempt to work out what is happening at Margate at the moment. But also Mark in Risdon Vale says Bowen Bridge is banked all the way back to the Goodwood Lights in the right-hand lane. And so, a fair bit of stuff going on traffic-wise. But coming back to our conversation in relation to these different conditions,
yes,
what would you like to see happening with regard to medical education and other issues affecting people with various things, for example, as we've discussed, chronic fatigue syndrome, but also the long COVID patients?
Yes, I was in Canberra a couple of weeks ago speaking to Mark Butler, our Minister of Health, and there's a group called the Friends of ME/CFS in Parliament, and I spoke to parliamentarians, including Mark Butler and his deputy, Mike Freelander, and basically they heard me loud and clear. We need funding for education of undergraduates, GP registrars, which are the junior doctors who become GPs and specialists, and then GPs en masse. Because there are so many patients and there's only a few people, and I've trained 2,000 or 3,000 doctors in the last 3 years through various organisations that I lecture for, and that's now ceasing because I'm retiring. But, most of these doctors had never even heard of these conditions, let alone had any skill base until I taught them how they could approach a patient with ME/CFS or one of these chronic undefined autoimmune diseases where the blood tests don't guide you to the answer. So first thing we need is funding. We definitely need funding for research as well, not just to training GPs. And I think we need notification. In other words, when you've got a disease that you've clinically diagnosed, like ME/CFS or autoimmune disease or long COVID, that you give it a number. You tell someone, like you do with Ross River fever or HIV, if you diagnose those conditions, tuberculosis, they'll get reported to the authorities and they'll be numbered. And we don't do that with these conditions, even though so many people are impacted by them. So those 3 steps of funding the GPs, training, funding the research, so we get improved management and treatments, and finding out the number of people affected by this is what we need to do. And that can happen now. We don't need to wait for an election. We just need political will by whoever's in power to change the paradigm. Now, I've been treating and diagnosing these conditions solely for 27 years, and you mentioned tick-borne illness, if you want me to mention that.
Yeah, now we don't really get many ticks in Tasmania.
Well, you do have some.
Do
but
we get the dodgy ones, though? Do we get the
You
ones
do have. I have seen patients from Tasmania, but because people travel outside of Tasmania,
of course.
You are an island, but you do have ticks there, and you do have a type of rickettsia or scrub typhus, and it's related to Flinders Island, which is where it was originally discovered. So yes, you do have some tick-borne illness. You don't have Lyme disease, as it's called in America. That's an American disease, and often this is mistaken in Australia that we have Lyme disease in Australia, but we definitely have infections very similar to what they have in Europe and America from ticks, and that includes borreliosis, which is the germ that causes Lyme disease. We have a different germ, but it causes a similar illness here. And I've seen patients from all over Australia, about 1,200 patients that I've seen with a tick-borne illness, and I'm currently involved in research being funded privately to investigate diagnostic paradigms for this condition in Australia. Because these patients, if you're ME/CFS, that's one thing, but if you're a tick-borne illness patient, you will not get help. No doctor will go near you because the risk is their licence or their credibility may be impacted if you diagnose and treat them, which is a travesty. It means you've gaslighted that person automatically if they come in and say, look, I've had a tick bite and I'm sick. You can't get help. That's not particularly good for our healthcare system or what we should be doing for all Australians.
And they make you feel dreadful, don't they? My partner was bitten by a tick in northern New South Wales in Byron Bay.
Well,
and, you know,
high incidence of tick-borne illness up there.
Okay. And, yeah, it really knocks you out, doesn't it?
Well, there's acute illness with ticks, and you can get allergic reactions, you can get some sort of toxic reaction ticks. Occasionally you get scrub typhus or rickettsia or Bartonella infection, which are known to be in Australia, can make you acutely ill. But it's more the chronic changes that you get. And we know there's something called mammalian meat allergy. So you get enough tick bites, you get allergies to all sorts of meat, beef, lamb, pork, but you also can develop a chronic autoimmune type process, and I definitely see people get autoimmune diseases after tick bite, and particularly ME/CFS. So people say, look, I got a tick bite a few months ago, I'm not well, and they gradually get worse until you diagnose and formally manage them and provide evidence-based treatment, which there's world's best practice for all these conditions worldwide, except we deny the diagnosis, so therefore the patients get denied the treatment and the management.
Had a texter that says they're wondering if you might be able to answer this question, and that is let me get it here. They're wanting to know where fibromyalgia might fit with these conditions.
Fibromyalgia, look, I've worked out a nomenclature, a way of diagnosing and treating this disorder, and fibromyalgia is purely it's related to ME/CFS. It's just where the pain is dominant. There's fatigue and there's sleep disturbance, but the fatigue is less dominant than the chronic muscular pain that people experience. The mechanism is not clear, but it is part of ME/CFS. It's an umbrella term for a whole range of syndromes. And a lot of people who get sick with fatigue and whatever, they also develop these what we call comorbidities, other illnesses as a result of having this inflammation in their body, from type 2 diabetes to metabolic syndromes to paralysed bowel to neuropathic pain syndromes, muscular pain syndromes, fibromyalgia, autoimmune diseases, and POTS, where people have low blood pressure, high pulse rate. So there's a whole range of symptoms, and we see it with post-COVID. So post-COVID, even though it was a terrible pandemic and it's affected millions of people, far more people are going to get long COVID than die from this virus. And unfortunately, worldwide, I mean, it's a travesty, but we have not paid enough attention to this. And we could have 200 or 300 current patients with ME/CFS from COVID, and they're not being diagnosed and they're not being treated.
So when you refer to that, for anyone who's just tuned into the conversation, we're talking about chronic fatigue syndrome.
Chronic fatigue syndrome from COVID or from tick bites or other causes of this condition, because something triggers it. And some people will have a predisposition. You often see these conditions in families. There'll be an aunt or both children will have it, or the parent will have it and the child will have it. So there's obviously some genetic component to this, and there's risk areas of, particularly for tick bites. Some areas are more prone to have these ticks which carry infection, and we call ticks nature's dirty needle. And that's what they call it in Europe.
Nature's dirty needle.
And they have a proboscis that stabs your skin, and they regurgitate their contents of stomach and saliva into your body, gets into your bloodstream, and it could be weeks or months before you get sick. And you may not even know you've had a tick bite because they bite you and fall off. They're not meant to get stuck in your skin because that doesn't help their reproductive cycle. So this is a tricky illness, and we don't have a good way of diagnosing, and definitely we don't have a good way of managing or treating this unless you're informed. And that's got to come through GP education and government recognition of these conditions. You know, the way the guidelines are written in Australia, it's counterproductive to actually diagnose people with these conditions. It's not helpful, and that makes it very difficult for GPs who aren't properly trained, and extremely difficult if you're a patient with this.
So many things to discuss in this area, but we've virtually run out of time. I want to know, before we let you go, how are you actually going to be enjoying your retirement? Or will you just be sitting on a million boards and still doing more research?
No. I think I've just been given a position. I said about 5 hours a week is about my limit. I've got grandchildren. I've got gorgeous kids. I'm happily married, and I like cruising up and down, seeing my family in Brisbane and Melbourne and in Sydney. And, there's lots of things to do, and I'm interested in all sorts of arts and whatever. So, I mean, I'll be doing lots of other things other than research. But, I mean, this is an important part. I won't lose my voice, and I'll actually stay a voice for this patient cohort. And I'm always available to talk to people, and I am going to further the science, because if that's what I can do and have a diagnostic biomarker test that fills the gap between the patient's illness and the doctor's belief, that will be a good legacy for what I've been doing for the last 46 years.
Well, it's been lovely to chat with you, and
it's an absolute pleasure.
Thank you so much.
Pleasure. Great.
Dr Richard Schloeffel, who has decided to, mostly retire, but not completely, after a very distinguished career spanning more than 46 years. And he is a specialist in everything from, chronic fatigue syndrome, autoimmune conditions, but also tick-borne diseases.